Hello everybody, I'm Chiara from Spezieria Palazzo Vecchio and today I'm gonna talk to you about menopause and menstrual disorders. Menopause is not a disease, but it represents a woman's physiological status and is specific to each one. It consists of a series of profound changes in both the emotional and physical spheres. The main physical characterization of menopause is the permanent cessation of menstrual cycle. Well, the menopausal age can be schematically divided into premenopause that starts at 46 and lasts until 50 years old. Then we have menopause between 48 and 52 years old, and postmenopause usually up to 65 years old. At the base of menopause, there is a decrease of hormones and therefore fertility. In particular, we have initially a decrease in progesterone, which coincides with the phase of menstrual irregularity. After, we have a decrease in estrogens, which manifests itself in the absence of menstruation. In particular, it is the decline in estrogen that affects all systems, like the central nervous system, the mucous membranes, the immune system, the cardiovascular system, bones and skin. Let's see now what are the main disorders caused by this drop in hormones. We have hot flashes, headaches, trouble sleeping, reduced libido and vaginal dryness, hair loss, urethra atrophy that usually looks like cystitis, slower metabolism which inevitably leads to weight gain. There are also several complications due to the menopause. We have osteopenia and osteoporosis, metabolic syndrome and insulin resistance, increased cholesterol, therefore cardiovascular problems. As therapeutic paths, we have increasingly moving towards an holistic, non-conventional therapy that takes into consideration a whole series of habits, such as specific nutrition and physical activity, and also natural remedies that act both on the part of the physical disorders, but also on that of physiological disorders. Let's see what are the natural remedies useful in this case. There are 3 plants in nature that have an estrogenizing action. That is, they help replace the estrogens that are less in menopause. These plants are sage, soy, and hops, and all of them contain isoflavones, which are substances that mimic the action of estrogens. Therefore, they have a positive effect in relieving hot flashes and in acting on anxiety and mood disorders typical of the menopausal state. Another useful element in lowering cholesterol is OENOTHERA oil, which is very rich in omega-6, which thin the blood and therefore lower the risk of cardiovascular disorders. The use of omega-6 is also recommended for female problems such as menstrual pain and polycystic ovary syndrome. In addition, they increase the bone density, favoring the assimilation of calcium and the deposit of this element in the bone tissue, thus preventing osteoporosis. About horsetail, we have already encountered it when we talked about bone and joint problems, of which I invite you to watch the video, because it is a plant that contains many mineral salts, including calcium and silicon, which are excellent for remineralizing bones and therefore preventing osteoporosis. Not only that, but horsetail is also a powerful diuretic, and this action is very important for the atrophy of the urethra that occurs in menopause. Let's talk now about passionflower. Passionflower owes its action to flavonoids, including hyperoside and Vitexine. because they promote sleep and helps in all sleep disorders that, if you remember, are very, very frequent with menopause, as well as nervousness and irritability. A 2001 double-blind study showed that when taken for 30 days, passionflower reduces symptoms of anxiety. Well, these active ingredients are found in 3 different supplements. We have 4-Lady, which contains hops, sage, and soy. They are, as I already told you, estrogenizing, but also chamomile and passionflower. They are both calming, and the whole supplement is specific for hot flashes and also mood swings, but it's also very, very useful in all menstrual disorders. Next one is Magnesio Calcio Equiseto. It acts as a diuretic and a remineralizer to prevent osteoporosis. And the last one is the OENOTHERA oil. It contains omega-6 to thin the blood and reduce cholesterol. To understand when and how to take these products, always remember to consult a doctor to whom you can illustrate these products by downloading the information sheets found in the links here on the left. That's all for today. Thank you for being with us. A greeting from Spezzia di Palazzo Vecchio.